My monthly injection is normally $60 a month that I take for my migraines. So I went to go pick it up yesterday because I'm due for my shot today. Guess how much it was? Just guess. Nope. Higher. $780. $780, and it's normally $60. I can't buy it. I have tried GoodRx. I have tried Amazon Pharmacy. What else did I try? I have looked up like copay cards. I have insurance through my husband's work. So that's the cost after insurance is $780. The pharmacist told me that whenever it was originally sent in, there was some sort of a coupon code attached to it. So that's why I was getting it for $60 a month. I never would have even started it had I known it was going to be almost $800 to refill every single month. This isn't even a life-saving medication. This is just so that I can live a semi-pain-free life. So for the people that need life-saving medication and can't afford it, what on earth are you supposed to do?
Hi, welcome back to the channel. Thank you so much for stopping by. So we're going to be checking out some videos on healthcare because a lot of people are actually going on a big rant, and that's actually making many people rethink about getting any health insurance this year. The price has really went up and it is unaffordable for many people. There are a lot of people who are actually opting out of it. So we're going to be checking out this video, but before we get right into this video, please make sure you click the like button. It helps with the algorithm and I appreciate that so much. Let's get right into this video.
I canceled my health insurance. I've seen firsthand how broken the system is. Health insurance does not cover true health care. It covers sick care. But they've got you covered if you want pills, procedures, repeat visits, diagnostics that are actually endangering your health, but not if you want true prevention. Functional labs? Nope. Nutritional support? Forget it. Root cause healing? Yeah, right. Let's be real. They want you sick just long enough to stay dependent. That is not healthcare. It is a prescription for illness. I refuse to continue feeding into a system that profits from keeping people unwell. It's disgusting. I invest in prevention, wisdom, restoration, not crisis management, disguised as healthcare. Your body was designed to heal, but you will not find healing where profit is worth more than people. I don't need insurance to trust the body that God designed. If you give your body what it needs and remove what is not meant for you, your body does the job. It is built to self-heal. I'm on the hunt for truth, freedom, and informed choices. That's what I offer to my patients, and that is what I expect as well. Follow for more health truths that they don't want you to know. I got you.
I canceled my health insurance this morning. I thought I would have anxiety and fear. Turns out I feel like I gotta...
We need to talk about this. I am so fed up. Fed up. I'm a numbers lady. I'm an accountant. And it doesn't make sense how much we spend on health insurance premiums. Plus, we have huge deductibles. Plus, and nothing is covered by the insurance, only prevention. And of course, make sure you follow all the rules. Don't ask the extra questions in the appointment with the doctor. Why? Because you will get billed separately for that. The lab work that you get is so freaking limited. You don't find out anything about how it's going on. How is this? A doctor doing this for 10 minutes going to check if you have really something going on. So why am I spending $1,000 and it's going to go up to $1,100 for myself and my son? For what? What is that? Almost $13,000 a year. And on top of that, to cover what? A pap smear, a mammogram, a couple of cleanings, and for a doctor to go like this? No. That's the reason that I have gone to Mexico for gastric sleeve. I have gone to Mexico for dental work, crowns, everything. And now that I'm married, my husband is Brazilian, I have visited Brazil, we are stopping paying health insurance. Well, he doesn't have health insurance, but I am stopping and saving all that money and get all the tests. And I'm sure with $1,000 in a great doctor that really cares the word they're touching, I could get an MRI, CT scan, pap smear, mammogram, dental visits, crowns, maybe even a facelift or a neck lift. That's what I need after losing all this weight. This is insane. Thank you, Luke, for sharing this and saying it. My insurance renews in a month and a half, and I'm not renewing it. I'm doing just like you. I am putting that money on the side and saving for emergency because this makes no sense. Why is the government making money out of our health? No. It should be they working for us. They want us to have a better life. But no, they're making us more poor.
Millions of Americans bracing for higher costs and tougher choices because enhanced ACA subsidies are going to expire at midnight. When those healthcare premiums run out, prices are expected to skyrocket. KFF estimates the average premium will go up by 114%. One man tells MS Now his costs are about to shoot up from $837 a month to $2,155. That's a $1,300 increase. His plan? He will stop saving for retirement so he can afford health care for himself and his wife, who has type 1 diabetes.
Short term, savings get zeroed out, plan savings get zeroed out to pay the premiums. Try to grow my income to a point where I can save again. My wife and I have done a little bit of research into longer term, maybe leaving the country.
In response, some states like California, Colorado, Maryland, and New Mexico are trying to pick up the tab and ease the burden for residents. But some lawmakers are warning this won't last long. Joining me now, MS Now congressional reporter Kevin Fry. Also with us, MS Now's Ariel Hickson. Ariel, you've been talking to a number of Americans who are concerned about their healthcare costs. What more can you tell us about all of the stress that they're under right now?
Well, I think what they're really trying to grapple with is the fact that once the clock strikes midnight, their premiums, as you mentioned, are going to go up an average of 114%. And so many of these individuals are deciding whether they're going to be able to afford rent, put away money for retirement, or in the case of the gentleman from right before, have the ability to potentially take care of families or family loved ones who actually really depend on these healthcare premiums. Now, this comes as so many individuals are at the point where they're concerned about what is going to happen in the future, because at this point, the premiums might be an average of 114% up, but in the next year and the year afterwards, the concern is that this is going to only rise higher and higher. And the fact that lawmakers on Capitol Hill haven't been able to come up with some type of decision is what's really frightening for them, because they feel as if they're not being prioritized as Americans. I spoke to one woman who said that she doesn't even know what the quote unquote American dream is at this point. And right now she's debating how she's going to take care of her children moving forward. Take a listen.
I think it's just, the impact on us has been a whole lot of stress, a whole lot of frustration, and I still don't know. I still don't know what's going to happen. I don't know if we're going to have to change careers. You also can't just magically go find a job in your field that has benefits on the drop of a hat. So people are being put in impossible situations, and I think it's going to get a lot worse, to be really honest.
Starting February 1st of 2026, we have chosen here at the clinic to no longer take any form of healthcare insurance. This comes for a variety of reasons. So healthcare is changing rapidly. Insurance premiums are rising in some areas, including our local area. For the average income, premiums have risen for some patients up to 20% of their annual income. That is not sustainable. Patients are having to choose between paying their mortgage or seeking healthcare, and deductibles are so high that patients are not utilizing their appropriate care sources, like going to the ER when they need it or going to an urgent care when they need it, nor are they taking the time to go see their primary care provider because they're concerned about how those costs add up and what happens with your outside services like your labs and imaging testing.
So now that we are into the new year, 2026, ACA subsidies have expired, meaning that millions of Americans are going to be facing much higher healthcare costs. This woman in Texas, for example, was paying $630 a month for her family's healthcare premiums, and that is going up to $2,400 a month. The article goes on to say that the woman's husband has a condition that requires blood clotting medication, and that costs $70,000 a month without health insurance. This is what the government shutdown last year was about. The Democrats wanted to fight to extend the ACA subsidies to last another 3 years, which would have cost the government $35 billion per year. Republicans were fighting to cut those healthcare benefits for millions of Americans. That is why the shutdown happened. And Republicans were saying that they were going to vote on it again in December, and that didn't happen. So now millions of people are going to be losing their health care, or, their insurance premiums are going to, double, triple, quadruple. It's interesting to me that, apparently we can afford to run Venezuela, but we can't afford to give our own people decent, affordable health care. That just seems a little suspicious to me. Regardless of what your thoughts are on Maduro or on the situation in Venezuela, isn't it interesting that we always have money to invade other countries? We always have money to, change regimes in other countries and go to war, but we never have money to take care of our own people. And I find that so just disgusting that people in Congress who are, most of whom are millionaires, or, multimillionaires, people who do not have to worry about their healthcare benefits, or, people that don't have to worry about, where their next meal is coming from. They have no problem taking, basic necessities away from the people that they supposedly represent. So, yeah, if you are a Republican and you're losing your healthcare benefits because the ACA subsidies expired, you voted for this. So I guess enjoy paying all of that money and watching your tax dollars go to Venezuela instead of your own health care.
I think we should all cancel our insurance. Yes, I mean that. Obviously, this isn't going to work for everybody because some people have medication that they simply cannot afford without insurance. But to everybody who can, here's the math equation. You price out how many times you need to visit the doctor a year, how much your medication is per year, and you add that number up. And if that number is less than how much your insurance is every year, then cancel your insurance. Because without insurance, if you're paying $8,000 a year, but with insurance, you're paying $26,000 a year for insurance, then it just doesn't make sense. Put that $18,000 in your pocket and just pay out of pocket for everything. How nice would it be to have an extra $18,000 in the bank every year? And if we want change to be enacted in our country, this is the way to do it. You have to hit their pockets, hit their wallets, because money's the only thing they care about. And if you don't know the cost of how much your healthcare is without insurance, call your doctor and find out. Because I've asked how much it's going to be with insurance and without insurance, and somehow most of the time without insurance, it's cheaper. Even though that does not make sense at all. But imagine what would happen if every American did this. If all of a sudden, over the next 2 months, where insurance companies are expecting millions of Americans to sign on for insurance for the next year, if instead millions of Americans canceled their insurance, you would see absolute pandemonium in the insurance companies. They would be losing their minds. Because when they expected to make billions of dollars in profit this year, instead going to be billions of dollars in losses. This is the way to make change. Because as we've come to learn, they don't care about morality, they don't care about gods, they don't care about anything other than profit margins. So hit them in the profit margins. Healthcare needs to change in our country. It shouldn't be a profit margin. It should be a right. And if enough people see this, we can make real change in our society. Send this to your friends, send this to your family, do all the things here. I genuinely think that this could be the strategy to change healthcare in our country. Thank you all so much for watching, and I appreciate your face.
There's a lot of chatter happening right now about the fact that the ACA credits expired at the end of last year and that potentially 10 million Americans are going to get kicked off of healthcare, and the rest of us are going to see up to a 115% increase in our healthcare premiums if we are not employed or get health coverage through our employee provider. I'm not going to dwell on that. You know why I'm not going to dwell on that? I'm going to circle back to the 7 sellouts. The average American probably doesn't know a lot of US senators. I unfortunately know who these 7 people are. Fetterman, Cortez Masto, King, Durbin, Kane, Shaheen, Hassan, Rosen. Why the fuck do I know those names? Because they voted because they were promised a vote to actually try and reinstate the credits. They were promised by Republicans. Yeah, of course, we're gonna vote on this. Sure, nobody should be letting them off the hook for this because there's not gonna be a vote. Mike Johnson has already come out and said, nah, we're not gonna do that. I know we said we would. I changed my mind. So yeah, we're angry about the fact that the credits are gonna expire and 10 million Americans are potentially gonna get kicked off of healthcare and people are going to die. People are literally going to die. Not to mention the fact that there are widespread reports now of hundreds and thousands of people who went through open enrollment not knowing that if they didn't change anything, they were just going to get folded over, stupidly thinking that nothing was going to happen. And they're now finding out that, hey, your deduction is now higher. Your payroll deduction is now higher. Healthcare costs were the leading contributor in Q3 to the 4.3% GDP that was reported. Healthcare costs. So yes, to those 7 senators who just thought were like, oh, I'm doing this in good faith. Why would you have faith? I am so mad that I actually donated to Fetterman's campaign. I am so mad right now.
I pulled the trigger. I canceled my ACA healthcare starting at the first of the year, and I am moving forward with a health share for our family. We decided on Zion over New Health, just simply because there's more people involved in that. Even though I liked New Health better, this is just my first foray into this world, and I kind of wanted to have the security of a share that had lots of members. And then we also have another friend that is using Zion too. So that is what we are doing. I cannot believe that I canceled my health insurance. Like I said, it was going up to $2,500 a month for a family of 4, healthy, no problems, nothing. Me, my husband, and 2 kids. So, yeah, rather than that, we are now doing, I think it's the 2,500 IUA, and it's something like $380 a month. And hopefully we never have to use it and we continue being really healthy. And this is just in the time being that the government figures out what the fuck they're doing, because this is insane. I cannot believe how stressful this has been. I cannot believe that this is America. I mean, I can completely believe it, like, duh, but it's just so insane. And I've been so traumatized by dealing with health insurance over the last, 4 years between 2 pregnancies and births. I swear, if the unlikely event that I ever got pregnant again, we would be going to any other country nearby to have this baby or that baby, because I would never do it again in the United States. Just simply because of the battles that I had to fight with our insurance to get them to cover what they were supposed to cover for over a year after my baby was born. So it's kind of a sad day. In some ways, I feel kind of liberated, and I'm also really nervous because the only reason you have insurance is because it's fear-based. And now I am ripping the Band-Aid off of that, and I'm rolling the dice. And it's a shitty place to feel like you're in. But here we are. So let me know if you have had any, if you're doing the same thing. Like, what are you guys doing? I'd love to know. All right. Wish us luck. Bye.
Hey folks, it's Phil here at Harris Automotive. Am I the only one that's feeling the crunch of the health insurance premiums that went up over the weekend? I don't care if you're on the right, you're on the left, or you're somewhere in the middle. People in America shouldn't have to make a choice on, do I have health insurance or do I feed my family? Do I have health insurance or do I pay my electric and gas bills? Whatever it is, you shouldn't have to sacrifice the way you are living, the things that's important in regards to your health insurance. Now, when I first got on Obamacare, when I opened up my business, Obamacare came out, I'm going to say 08, 09. As soon as it opened up, that's when I got on it. At the time, I was spending $60 a month for health insurance premiums per month. I was in heaven. Of course, slowly over time, now in 2025, it just keep creeping up every single month. So now for the same health insurance, I'm spending, well, in December 25, I was spending $668 per month in health insurance premiums. Now just went, as of January 1st, the $982 a month for the same premium. That's about a third, for the same insurance, about a 30% increase. I mean, all my self-employed people are people who buy, who have insurance through the marketplace. Does yours go up about the same 30%, or did it skyrocket more, or did it go down? Let me know in the comments.
Seeing as the health insurance premiums have been going up every single year, as you can see in this video, it has gotten people to the point where being forced to make a choice to either pay this huge amount of money every month or just hope to not get sick and stay healthy throughout. Just pay out of pocket if they do eventually fall sick or need any healthcare. It's a sad reality for most people to come to this decision, but the health insurance is just ridiculous for people to pay because most people cannot afford it, and that's just the reality. They cannot afford it. Like, it's high enough to the point where people cannot. The rate in which it has gone up, maybe these insurance companies do think that people do not have other bills to pay and they just receive their paycheck and the only bills that they have is their health insurance, and that's just about it. Just tell me why a person should be paying this huge amount of money for a monthly bill. I don't blame people, because what makes this actually worse is that even when you have insurance, you're still paying high deductibles, high co-pays, and surprise medical bills. So when people are asking this question, why am I paying all this money, just to still avoid going to the doctor? And most of the time when you even go to these hospitals, honestly, I just don't know. It seems like the healthcare, the business part of it is just way too huge and more prominent than actually the part where they are actually supposed to care for your health. Sometimes a lot of people are actually saying that they have noticed that mostly the doctors are actually very dismissive to your health problems, like your concerns, what you complain about. So it just doesn't even seem to be yielding results, unless maybe, I guess, you are on your deathbed. Maybe that's when you might even get some treatment or something. Like, when people go and keep complaining, many people have had this experience where they even go to the hospitals, complain about something, and their doctors are dismissing them. It's like, what are you even paying for at the end of the day? If you've made it to the end of this video, please make sure you click the like button. It helps the algorithm and I appreciate that so much. And subscribe to the channel if you're new here and you're watching me for the very first time. Hit the notification bell to get notified every time I post a new video, and leave your thoughts in the comment section down below. I would love to see what you think about this video, and I'll see you on the next one